How you doing, Instagram? Dr. Nathan Thompson here with the Wellness Way Yorkville. Happy Monday evening. Hope you guys had a great weekend. If you're joining right now, even if you're watching replay, give me a wave, say hello. Thank you so much for watching. I just got back. My son had a football game, so I ran over there and I ran back. And while I was coming back, I got stung by a wasp right on my arm. It hurts. So today we're going to talk about menopause and your cholesterol. So there are so many women. This is a very polarizing subject regarding menopause and how at menopause everything falls apart. So if you are someone who saw your cholesterol levels jump up, if you are someone who experienced terrible joint pain, I'm going to explain to you why. And maybe help you guys see this from a different perspective. We're going to use the old trusty Guyton and Hall's medical textbook of physiology. So, when people say, where'd you get that from? Actually, from a physiology textbook that I learned while I was in school, whether it's naturopathic school, chiropractic school, osteopathic school, medical doctor school, medical school. They all use Guyton and Hall's medical textbook of physiology. It's amazing how much they've forgotten. This is actually the latest edition that came out about a year and a half ago. So let's go back to the trusted source of Guyton and Hall's medical textbook of physiology. If you guys want to, you can watch this on YouTube or Rumble or even on Facebook at Dr. Nathan Thompson, because you'll be able to see the slides. It makes it so much easier, but you're welcome to watch on here as well. So if you didn't watch yet, I just released a new video on how to control the pandemic of lower back injuries. It's a parody. You might want to watch that, and when you see that, you're like, "That's ridiculous." And I said, "Exactly. There's a reason behind that." So I tend to do a lot of parody. Sometimes people don't know I'm joking or not. It's just my personality, so I apologize. So menopause and your cholesterol, guys. This is going to be really good. And again, if you're watching, make sure you say hello. Let me know also where you're watching from. We're going to get started here in about 30 seconds or so. So hello, Teresa. Thank you so much for joining. Wow, a lot of people on right now. Thank you guys so much. And just let me know, leave a comment where you're watching from as well. We're going to get started here in about 10 seconds. Let's make sure my mic is turned on too. Hey guys, welcome to today's live broadcast. My name is Dr. Nathan Thompson with the Wellness Way Yorkville. Thank you guys so much for joining us. If you are watching us right now, whether you're on Rumble, if you're on YouTube, or if you're on Facebook, make sure that you say hello and make sure that you let me know where you're watching from. And also, if the sound is good, make sure that you can hear me. So sometimes the sound works, sometimes it doesn't work. Let me adjust the mic just a little bit. So we have people from Arizona, from Australia, from Maryland, awesome, from the Philippines, from the great state of Wisconsin. Guys, thank you so much for joining us. I'm going to talk about an interesting subject, menopause and your cholesterol. So if you are someone who has gone through the transition of menopause and you saw that your cholesterol levels, your LDL jumped up and you're like, what on earth just happened? I'm going to explain to you why. Also why you may be experiencing things like joint pain, why you experience some increase in inflammatory levels during menopause. I know that the thing that, the flavor of the day is in order to do hormone replacement therapy, but I'm actually going to show you using an example why that doesn't make sense and why we have taken menopause, which should be just a transition of life, and how we have turned it into an illness and a disease. Remember this, and I will say this, remember this, hormones don't make you sick. Hormones are responding to the sickness. So dumping hormones in is only covering up the sickness and the illness. That's the biggest thing I want you guys to understand, and that menopause is not some kind of illness. Even though you feel bad, that's not the sickness, that's not the illness. And I love it when people say, you're just mansplaining. It's like, come on, guys. I thought this was 2023 in which men and women are considered equal. And so, what's interesting is if I said the same thing, if a woman said something about testosterone and she was right, I have no problems with that. So what's amazing when it comes to a woman's hormones is that most women don't even understand their own hormones. And so it comes down to talking about this from a physiological standpoint. It doesn't matter, guys, if you're a man or if you're a woman. So while we have people jumping on right now, while a lot of people, make sure again that you say hello, let me know also where you're watching from. And also while we have people jumping on, guys, tomorrow is the day. If you're from the Chicagoland area, it's our Approach to Inflammation in-person event. This is going to be at Exemplify Health Center at 6 o'clock p.m. sharp. Guys, this has to do everything with menopause as well, is that if you do not address inflammation, then you will have issues, guys, whether it comes to weight loss resistance. This is tied to cancer, chronic low-grade inflammation, hormone issues in relation to infertility, thyroid issues, arthritis, joint pain, type 2 diabetes, hormone issues, autoimmune conditions is all tied behind inflammation and the immune system. Everybody talks about how to lower inflammation, but a lot of people just don't realize, well, it's not the immune system that's doing the wrong thing. It's the fact that you have inflammatory triggers and the immune system is actually just doing its job. If you are from the Chicagoland area, get registered for that. The next time that we're doing that is tomorrow, and then it'll be 3 weeks after that. But also, if you are watching from the contiguous 48 states, okay, so this is not, I wish we could help everybody, but we're just limited depending on country. And also Hawaii and Alaska is also pretty tough. But contiguous 48 states, you want to know about inflammation and you need help. I have so many people just reach out. I'm like, just please watch the inflammation talk and then schedule a discovery call with me after that. That just makes it easier so that we are speaking the same language when it comes to inflammation and why we make certain recommendations and testing, obviously, first. So all you have to do to go to that is go to the Linktree profile, whether you're on Facebook, you go to the top of the page. If you're on YouTube, if you're on Rumble, go to the top of the page, you'll see Linktree. Click on that and you'll see the inflammation webinar that you can get registered for that. It's free to attend. It's every Tuesday and Saturday, I think Tuesday night, Saturday morning, but then also you can do a live replay. If you have an hour to spend right now, you can watch it on demand too. So that is the webinar. And then coming up, guys, I'm super excited about this. Dr. Patrick Flynn himself is going to be in Yorkville, Illinois for part of his I Disagree tour. And so he's going to be coming and speaking here in Yorkville at the wonderful, lovely Whitetail Ridge golf course. He'll be speaking there. And if you've been and seen him speak in the past, you know that you're going to want to come again. People are like, is he going to speak on something different because he came down 2 years ago? Yes, he is, because not only is he going to be talking about hormones, but he's also going to talk about other things that he disagrees with when it comes to healthcare, guys. And if you have watched what has happened over the last 3 years, there's a lot that you disagree with. And he puts it in such a unique perspective that I guarantee you this will be better than anything that you attend, whether it's a concert, whether it's a movie. So please, you can go to our Linktree as well and order tickets for that event. It's just $15. Tickets are going to go up probably by the middle of September. So get your tickets. If you are from Missouri, if you're from Illinois, if you're from Indiana, if you are from Wisconsin, if you are from Iowa, this would be beneficial, even driving to come to this event. I'm going to make a promise and a bold statement. Yes, it is that good. So make sure, guys, that you get registered for that. It's going to be an awesome, incredible event. So let's get into the meat and potatoes. Not potatoes if you're on the no sugar diet, but the crux of what I'm going to talk about tonight is menopause and your cholesterol. So the biggest question I get from a lot of people is, hey doc, why did my cholesterol, why did my LDL, low density lipoprotein, go up after menopause? I mean, everything was the same, and then all of a sudden it jumped up. There has to be a reason for it, but it's not explained very well when it comes to your doctor. So I want you to think of this. When it comes to menopause, when you go through the transition of menopause, what's the biggest difference between when you're cycling and after menopause? The biggest difference, guys, is your hormones. So I want you just to think about that. The difference is going to be my hormones, specifically estradiol, okay? Now, this is important to address because if you look at heart disease, I believe now that it's a little bit more women die from heart disease now than men. It just so happens that after a woman hits menopause, they catch up. So they're way behind as far as number of deaths, until they hit menopause. And you can see by looking at this graph that they start to catch up. And so when they catch up is approximately when they hit to be, about 70 years of age or so. And then I believe they even overtake men at that point. So when people say I don't need to worry about heart disease or coronary heart disease or cardiovascular disease and things like that because I'm a woman, well, you don't have to, you really do need to worry about it. It's just that if there are certain things taking place while you're cycling, when you hit menopause, that means that those things are going to rear its ugly head. And if you're having a hard time when it comes to menopause, it just means that those things were there, but they were being covered up by specific hormone. And I'll go into that in just a little bit. So let's go back to the trusted source, Guyton and Hall's textbook of medical physiology. Okay. Textbook of medical physiology, the latest edition, which is the 14th edition. It is 1,000 pages long. And yes, I have read all of Guyton and Hall's medical textbook of physiology. I'm going to take a pause here because I want you guys to know something. That education is, I will tell you this, education is completely overblown. And anybody who is just being intellectually honest will say the same thing as well. And this is someone who literally had 120 hours of college and then another 300 hours of postgraduate work. And I had my GPA was, I think, 3.96 or something like that, all the way through college and then also through graduate school. And to be honest, I did very well on tests, but clinically I had no idea what I was doing. And that is medical education. That's post a college education is all about jumping through hoops and memorizing enough to pass a test and then retaining it enough to be able to pass boards and then really just forgetting things about it. And so that's why education, I believe, is so overblown because there's so many people who are so highly educated, yet they literally need to read a book on how to tie their shoes. And that's why education, like I say, is completely overblown. This is someone who did very well when it comes to testing, when it comes to getting good grades and things like that. So let's go to Guyton Hall's medical textbook of physiology. And so the first question I want to ask you is, why did my LDL go up when I hit menopause? But let's go backwards and ask the question, do we need cholesterol and LDL? Because if you look at the current narrative, they say LDL, the lower, the better. The lower you can make your LDL, the better it's actually going to be. So from Guyton Hall's medical textbook of physiology, you see I highlighted a lot of different things, but here's what it says: specific uses of cholesterol in the body. So within an LDL is your cholesterol. Here's what's interesting. As much as 80% of cholesterol is converted into cholic acid. Cholic acid is conjugated with other substances to form bile salts, which promote digestion and absorption of fats. You need cholesterol in order to absorb and digest fats. Now, also a small quantity of cholesterol is used by the adrenal glands in order to form what's known as adrenocortical hormones. So this is any hormone that's made from the adrenal glands, things like cortisol and progesterone, some estrone, so and even antidiuretic hormone. So hormones that are controlling your blood pressure, that are actually even controlling, allowing for female hormones like estrone, which is a weaker estrogen, and also progesterone, and also cortisol, which you absolutely need as well. So you do need cholesterol in order for that to happen. And also you need cholesterol in order to form testosterone from the testes. Now, here's what they also say is these glands can also synthesize their own sterols and then form hormones from them, as discussed in chapters of endocrinology. So you get your hormone production from exogenous cholesterol from blood, and you also can manufacture hormones from cholesterol from within the cell, okay? So there's two different ways that you actually can synthesize it. Now, a large amount of cholesterol is also precipitated in the corneum of the skin. I want you to pay attention to this. So this cholesterol, along with other lipids, makes the skin highly resistant to the absorption of water-soluble substances and to the action of many chemical agents, because cholesterol and other skin lipids are highly inert to acids and to many solvents that might otherwise easily penetrate the body. Also, these lipid substances help prevent water evaporation from the skin. Without this protection, the amount of evaporation can be 5 to 10 liters per day instead of just 300 to 400 milliliters. So even cholesterol plays a role in the barrier that's formed by the skin, which is really interesting because I see a lot of cholesterol lowering drug promoters on certain social media platforms, and they brag on how they're on a statin drug and how low their cholesterol is, yet they all have super agey, dry, cracked, and saggy skin. And what's so amazing, guys, is that even cholesterol forms that barrier, which even when you think about it, could you technically have low cholesterol and you're slathering certain things on your skin that make it easily absorbable to be able to cross the barrier and form certain kinds of toxicity. So think of things that you put on your skin, i.e. parabens, for example, that can more easily pass the barrier of the skin because your cholesterol is way too low. And see, the problem with this is that doctors are only looking at cholesterol, but they're not seeing at all the other side effects that are taking place by lowering cholesterol to ridiculously low numbers. Now, also, what's cholesterol needed for? It's needed for the skin. It's needed in order to make certain adrenal hormones. It's also needed in order for bile acid formation to help you be able to digest your fats, but also it makes up every single membrane within your cells. So cellular structural functions of phospholipids and cholesterol, especially for membranes. It's what helps to, the membrane of the cell is literally the brain of the cell. It's not the DNA because it's the membrane of the cell that allows things to go in and also allows things to be able to go out. It's the gatekeeper of the cell. So cholesterol forms specialized structure, maybe membranes. Large quantities of phospholipids and cholesterol are present in both cell membrane and the membranes of the internal organelles of all cells, like your mitochondria. For membranes to be formed, substances that are not soluble in water must be available. In general, the only substances of the body that are not soluble in water, besides inorganic substances of bone, are lipids and some proteins. Thus, the physical integrity of cells everywhere in the body is based mainly on phospholipids, cholesterol, and certain insoluble proteins. Now, also, what do you talk about adrenal cortical hormones? Hormones that are made by the adrenal glands. They are derived from cholesterol. All human steroid hormones, which includes progesterone, which includes testosterone, which includes estriol, estrone, estradiol, which includes all of those intermediates as well, including those produced by the adrenal cortex, are synthesized from cholesterol. Now, here's what they say. Although the cells of the adrenal cortex can synthesize small amounts of cholesterol from acetate within the actual cell, approximately 80% of the cholesterol used for steroid synthesis is provided by low-density lipoproteins, otherwise known as LDL, otherwise known as the bad cholesterol in the circulating plasma. The LDLs will have had high concentrations of cholesterol diffused from plasma into the interstitial fluid and attached to specific receptors contained in structures called coated pits. So 80% of the hormones going to the adrenal glands is made from the bad cholesterol, otherwise known as circulating low-density lipoproteins. And that's how most of your hormones coming from the adrenal glands are made, okay? So what will cause LDL, or otherwise known as just your cholesterol, what will cause it to elevate? Let's go back to Guyton Hall's medical textbook of physiology, page 861. Here's what will cause an elevation of LDL. It's an increase in the amount of cholesterol ingested may increase your blood concentration slightly. So this is where people said, don't eat cholesterol because it's going to raise my cholesterol. The reality is that it only elevates it slightly, only about 10 to 15%, right around there. So it's what you eat as far as cholesterol is not making a difference in your overall levels. Here's another thing though. A diet high in saturated fat increases blood cholesterol concentration by 15 to 25%, especially when this diet is associated with excess weight gain and obesity. So this is why doctors have demonized saturated fats, because they see an increase in blood cholesterol when you consume saturated fats. Now, saturated fats are needed, guys. I don't know why they're so demonized, because the nuance when they talk about this is that it's affecting them more when you are obese. And so now what you have to look at is saying, well, if it's obese, what's happening with different kinds of liver dysfunction that is taking place? Because if you're obese, you're going to have a fatty liver, and now you're going to have a lot of liver dysfunction going on, the inability to be able to be, be sensitive to insulin. You're going to have problems with certain pathways when it comes to removal of hormones and detoxification, because the liver is involved with so many different body processes. A lot of people don't even know what it actually does. Energy, metabolism, with detoxification, so many different things. Now, ingestion of fat containing highly unsaturated fatty acids usually depresses the blood cholesterol concentration to a slight to a moderate amount. That's why certain unsaturated fatty acids are actually good, and they're also needed. But here's one. If you have seen that your cholesterol jumps up, and I have seen this numerous times, and I've seen it missed numerous times too, I want you to think of this: lack of insulin or thyroid hormone increases the blood cholesterol concentration. So if you have hypothyroidism, you will see an increase in LDL. You'll also see a huge spike when it comes to your triglycerides, mainly because thyroid is setting the metabolic tone of the cells. And if that tone is suppressed, you're going to get a buildup of LDL, and you're also going to get a buildup of triglycerides as well. But what's also interesting is that if you do have a lack of the ability to be able to produce insulin, you'll also see your triglycerides, you'll also see your LDL go up as well. There are a lot of people who cannot make enough insulin. We're not just talking about type 1 diabetes. We're also talking about certain people who don't have a corresponding insulin response to the levels of their blood sugar. Here's what's so interesting, and I've talked about this in the past, is do you know, guys, that if you're potassium deficient, you will have a lack of insulin secretion? Isn't that amazing? You need potassium to be able to secrete insulin. How many of you guys out there are getting 4,000 milligrams of potassium every single day? Yet the doctors demonize potassium as saying, well, because we put you on what's known as an ACE inhibitor, a blood pressure medication, you got to be careful about your potassium. And there's so many people who are walking around that are potassium deficient. And then the number five is from Guyton Hall's medical textbook of physiology of why LDL goes up. Genetic disorders of cholesterol metabolism may greatly increase plasma cholesterol levels. This is the go-to to most cardiologists. This is the go-to to most general practitioners, is that they just throw up their arms and they say it's just genetic. Now, is there something genetic about cholesterol? Yeah, it's called familial hypercholesteremia, and it's present from birth. Let me say that again. It's present from birth. But if your cholesterol is going up at 30, 40, or 50 years of age, is it really a genetic issue? This goes to the whole idea of if something's genetic, it's expressed from birth. However, you can change your genes based on your lifestyle. So it's like saying, well, you have a plant here and you feed it or you water it, you fertilize it, give it great soil, and it does great. Or you have the same plant and you don't water it, you put it into terrible soil, you don't fertilize it, and it doesn't grow. And you're like, I guess that's just genetic. It wasn't meant to be. So your genes are changing according to your environment, and it's called epigenetics. But remember, if you are blaming your cholesterol on genetics, then why wasn't it high prior to menopause? So it just comes down to, guys, just asking different questions. It's all about asking questions. It's okay to ask questions. So here's another thing, guys. How does plaquing occur? Because the idea is that if you have high LDL, that LDL just sticks to the arteries and it causes plaquing, and you're going to get a fatty buildup underneath the lining of the artery, and it's going to kind of squeeze out kind of like a pimple, and that's going to block the arteries, or it's going to rupture, or it's going to cause a clot. But how does plaquing occur? Again, coming from Guyton and Hall's medical textbook of physiology. When you get plaquing, it's called atherosclerosis. Atherosclerosis basically means fatty lesions and plaquing that to develop on the inside surface of the arterial walls. You know what's interesting though is that it only happens on the arterial walls. It doesn't happen on the veins. Have you guys ever wondered that? Now, the difference between atherosclerosis and arteriosclerosis: atherosclerosis is fatty deposits of plaquing. Arteriosclerosis is when you start getting thickened and stiffened blood vessels, and that can cause some issues when it comes to high blood pressure because they can't expand or anything like that. But here is what is interesting, guys, because arteriosclerosis and atherosclerosis kind of go hand in hand. One abnormality that can be measured very early in blood vessel health, that later can become atherosclerotic damage to the vascular endothelium, is known as when you have where nitric oxide metabolism, poor nitric oxide metabolism. So this is why when you look at a nitric oxide production, why this is so important in vascular health. So when you get any kind of atherosclerotic damage, this damage increases the expression of adhesion molecules on endothelial cells, which are lining the blood vessels, and it decreases their ability to release nitric oxide. So nitric oxide and other substances prevent adhesion of macromolecules, platelets, and monocytes. Remember, plaquing is an immune system reaction. After damage to the endothelium, vascular endothelium occurs, circulating white blood cells called monocytes and then lipids, mostly LDLs, begin to accumulate at the site of injury. So let me say that again, that when you start to experience problems with nitric oxide production, then what happens is that according to Guyton and Hall's medical textbook of physiology, that's when you then create an inflammatory response, migration of white blood cells into underneath the blood vessel wall. And then what happens is that then you have the migration of LDL into that area. So when it happens, remember, it's an inflammatory response. The cells responsible are called macrophages, and they form what are known as foam cells. These foam cells then aggregate on the blood vessels and then form a visible fatty streak. With time, fatty streaks go larger and larger, and the surrounding fibrous and smooth muscle tissue proliferate to form larger and larger plaques. Also, proliferation of smooth muscle and fibrous tissue on the inside surface of the arterial wall. The lipid deposits plus the cellular proliferation, like the white blood cells and the fibroblasts, can become so large that the plaque bulges into the lumen of the artery, or into this is the lumen of the artery, and greatly reduces blood flow. Okay. So when you talk about it, one of the first things that has to happen that causes endothelial dysfunction is an issue when it comes to nitric oxide production. But looking at it further, you have to ask the question then, so that we circle back around and talk about why your LDL went up, but also why it's not necessarily a bad thing, but you also have to address some other issues. So what causes endothelial dysfunction, which is the lining of the blood vessels on the inside? So this comes from International Journal of Biological Sciences, 2013. What causes endothelial function? Here's what they say. Endothelial dysfunction is characterized by a shift of the actions of the endothelium towards reduced vasodilation, meaning they're starting to constrict, a pro-inflammatory state, inflammation, and prothrombotic properties, meaning blood clotting properties. It's associated with most forms of cardiovascular disease, such as hypertension, coronary artery disease, chronic heart failure, peripheral vascular diseases, diabetes, chronic kidney failure, and severe viral infections. Interesting. Free radicals can disrupt the balance of nitric oxide damage, of nitric oxide that damage the endothelium and leave it overly permeable allowing toxins to pass into body tissues. Guys, ever heard of a leaky gut? Well, you can also have leaky arteries, and that has to do with loss of endothelial function by the inability to be able to make nitric oxide. If the body is depleted of these antioxidants, or if there are too many coexistent factors, injury to the endothelium and a change in the balance of nitric oxide may occur. If the endothelium becomes damaged, the nitric oxide levels become imbalanced, cells that should remain in the blood can pass through vessels into the adjacent body tissues. Some of these proteins include C-reactive protein. Pay attention, very important to measure, which is produced by the liver and also causes inflammation. Several factors that increase the number of free radicals in the body include obesity, smoking, not getting enough sleep, having acute infections from bacteria, high glucose intake or high amounts of sugar. In addition to that, exposure to metals and also air pollutants. So what do they just see here? What causes endothelial dysfunction that causes the whole thing to start off in the first place? Smoking, not getting enough sleep, infection, high amounts of sugar, diabetes, and toxins. This is the very thing that we talk about all the time, is we talk about the reason why people get sick. So you have to understand that if your doctor just says it's just all about LDL, who cares about anything else? There has to be dysfunction. This is why you have to go so much deeper than just having a doctor throw a statin at you and tell you that everything is going to be okay. Here's the reality when it comes to statin drugs. You take it for 5 years, and it reduces your risk of heart attack or death by about 2%. That's literally the real statistics, is that it lowers your risk by 2%. Even doctors will say, yeah, but take that over the course of maybe 35 million. That's a lot of lives. But the reality is that now that they're even admitting, well, that's why we need to control your cholesterol from a very early age. I mean, and if you think about it, if cholesterol was the number one reason why, then why don't we just put it in our drinking water and everybody just take it? And that is absolutely absurd. But there are now cardiologists that are talking about you can get your LDL down to 5 or down to 10. And meanwhile, they're looking at your cholesterol, but they aren't taking into account you need it in order to make adrenal hormones. You need it for your skin. And in fact, look at all of these cholesterol doctors and how dry and decrepit their skin is. I'm just like looking at this and I'm like, oh, great, your LDL is down to 40. But you look about 30 years older, okay? So that's why it talks about endothelial dysfunction first and foremost. Now, endothelial dysfunction is thought to play a role in the development of atherosclerosis, angiogenesis in cancer, the formation of new cancer pathways, especially when there's tumor proliferation, vascular leakage, infectious disease, and stroke. Endothelial dysfunction can be caused by several conditions, including diabetes, metabolic syndrome. This is why if they're not measuring your blood sugar, I'm sorry, or not even your blood sugar, your A1C and your insulin levels, hypertension, smoking, and physical activity. So that all of that will cause endothelial dysfunction. So here's some reasons for high LDL. This will even include men as well, that your doctor may not be looking for. Number one, are they looking for insulin resistance? How many of you have ever measured fasting insulin? You should be getting fasting blood glucose, you should be getting fasting insulin, and you should be getting A1C in order to get a better picture. We just had a woman today whose A1C completely normal, yet her fasting insulin levels were about 5 times higher than what they should be. We are intervening long before she has diabetes or pre-diabetes, but she's well on her way, even in her mid-30s. Inflammation will also do it. Now you have to find the source of the inflammation, whether it's infection, whether it's having a leaky gut, whether it's having a gastrointestinal infection, whether it is doing things that are damaging the body like toxicity or smoking. But also you have to consider as well, you have to consider hypothyroidism. And then you have to figure out why you have hypothyroidism. It's not just let's just give you another hormone. There are many reasons why someone can have a thyroid that's not working the way that it's supposed to. And I've talked about this a lot. Go back and watch the videos and specifically to thyroid, whether you're talking about, is it an immune system issue? Is it just a supply issue? Like you don't have enough of the raw materials like iodine, or you don't have selenium? Is it an interference issue with other halides like bromine? Is it also a conversion issue taking place? Because active thyroid hormone T3 has to be converted. T4 is mostly what is secreted. It has to be converted at the cellular level at T3, and this largely takes place in the gastrointestinal system, the kidneys, and the liver. So if you have problems with the liver, you will see that you're not converting it well, which is why doctors give you a thyroid medication and you're like, I don't feel any different, because you still have to convert it and they're not measuring the conversion. So here's what's interesting, guys, when we talk about inflammation, because is it all about LDL? The answer is no, it's not. It's too simple. This is what I just can't stand. If I can vent for just a second, what I can't stand about healthcare is that it's such a this for that approach. If you have this, take this. High blood pressure, take this. Hypothyroidism, take this. You have low hormones, go on hormone replacement therapy. You have high cholesterol, take this. There always has a medication for a this for that approach, and it's never ever getting to the reason why it's happening in the first place. This comes from Cardiology Today, and this comes from a study that they did, and they actually said inflammatory risk better predicts events versus cholesterol risk in statin-treated patients. So they looked at people who were on a statin medication, and you would think if statins were the only thing in order to prevent heart attacks, that the number of deaths would be equal irregardless of what your inflammation levels were. And one of the things that they found is that even with people with statin therapy, if their level of inflammation remained high, then they had more incidences of cardiovascular events. It was irrespective of whether it was getting lower or not, because it was getting lowered in all groups. So they're like, we need to be looking at inflammatory levels more than just cholesterol. This came from a cardiologist. But his solution wasn't, let's find the source of the inflammation. His solution was, they need anti-inflammatory therapy. That's what they need. Incredible. I know. Hopefully you're seeing, you're having the same eye roll that I am as well. But that's why if cholesterol was the only indicator of heart attack, then it would not only lower it by 2%, and you also wouldn't have more people who were inflamed that were having heart attacks with the same amount of statin lowering therapy than people who had lower amounts of inflammation as well. Now, all of that for 30 minutes to get to the main crux of why we're doing this live tonight. Why did my LDL go up after menopause? So hopefully we know, is there a function of LDL? Yes, it's needed. Also, what about LDL and heart attacks? Well, you have to have dysfunction taking place. You need basically vascular endothelial dysfunction taking place that then causes an immune system reaction that then causes the migration of cholesterol into the area that then can cause an immune system reaction from macrophages that forms foam cells that then causes fatty streaking and then continues until it finally causes atherosclerotic plaques. We know that smoking, we know that insulin resistance, we know that toxicity, we know that environmental toxins, things like that all contribute to it. And it's not just, oh, my LDL is going up and let's just, we're good now, we're good, as long as we just take a statin drug. I think that many doctors are doing a disservice. And actually, to defend doctors, I think some of them are so frustrated because there's so many people who refuse to change anything about their life. And so they just throw a statin at them and say they're not going to change anything. Or maybe they don't know how to guide a patient through in order to help them reclaim their lifestyle. So why did my LDL go up after menopause? So let's go and let's talk about hormones, okay? Let's talk about hormones. So think of this, the impact of estrogens. Notice how it says estrogens, because there's no such thing as the hormone estrogen. Anyone who's a doctor talking about hormones in the form of estrogen, probably they don't know what they're talking about, because estrogen describes a family of estrogens. So the impact of estrogens and their receptors on immunity and inflammation during infection. Well, Dr. Nate, what does that have to do anything with my cholesterol levels after menopause? Stick with me. So in this study, this is from 2022, February of 2022. So it's not even a year and a half old. Here's what they say. In this review, we discuss how estrogens change the host immune response, as well as how these changes can alter the outcome of the infection of the individual. So what happens with an infection? It's inflammation. Now watch. Estrogen levels during menstruation, pregnancy, and menopause, okay? Now, when discussing the impacts estrogen have on inflammation and immunity, it's important to consider how and when the levels of these sterols can differ. You guys realize that if you are cycling, your estrogens are different depending on the time of the month. You literally have 4 different levels of estradiol based on the time of the month. Now, prior to menopause, females have approximately 5 times more circulating estrogens as compared to males. However, these concentrations fluctuate with a menstrual cycle and can at times be close to that found in males. Guess what time that's actually going to be? When you're at the end of the month and you start menstruating, your progesterone, your estradiol levels are going to be very, very low. Interesting, females have been found or have been documented to experience, now listen to this, general low-grade inflammation and an increase in inflammatory markers such as C-reactive protein during the start of menstruation when estrogen levels are at their lowest. Let me repeat that because this is very, very important, is that females can experience general low-grade inflammation and an increase in C-reactive protein during the start of menstruation when estrogen levels are at their lowest. So I want you to think about this, that when they're at their lowest, females can then exhibit higher levels of low-grade inflammation at the start of their menstrual cycle. What if you took those levels into menopause? Can you experience an elevation of C-reactive protein and an increase in inflammation? Can that cause issues with joint pain? Yes. Can it cause issues with brain fog? Yes. But I want you to understand something. It's not the estrogen. The estrogens are blocking it, but you still have to have an inflammatory trigger. So hopefully you guys are making the connections with this. Now, number 2, estrogen levels are often at their highest in pregnancy. Let's talk about pregnancy, because how many of you, when you were pregnant, you felt absolutely fantastic? Your hair got better, your skin got better. If you have autoimmunity, it somehow just disappeared. You've never felt that good during that time. Here's the reason why. Estrogen levels are often at their highest during pregnancy, peaking during the 3rd trimester when circulating estrogen can be 60 times higher than in non-pregnant females. Now, it's no surprise that pregnant females have been shown to exhibit altered immune and inflammatory responses, meaning their immune system goes down, which means inflammation goes down. But also, what does your doctor want to put inside of you if you are pregnant? They want to put a vaccine inside of you because they realize that you are immunocompromised. That's why they recommend to get a flu shot, and that's why the FDA just released or just approved a new vaccine. I'm trying to remember what this is for. RSV, new RSV vaccine for pregnant women, I believe at 32 to 35 weeks. That's why, because they say, oh, you might be immunocompromised, even though it can cause preterm birth, preterm labor. They actually know that. So this was just released. We thought about doing a video on it. I might do a video on it coming up. But guys, if you understand RSV, not to get sidetracked, but RSV it literally kills about 1 in 650 people, like every virus that's out there. And it's well known that the people impacted by RSV are elderly, severely immunocompromised with a low neutrophil count. This is why we always say it's not about the virus, it's about the strength of the host. And that's why it's beyond me why doctors aren't measuring the actual immune system much more deeper than just doing what's known as a complete blood count with a differential. You should be looking at CD4, CD8, CD19, CD56. You should be measuring at all those other cells that are responsible for viral and tumor inhibition. Now, For example, pregnancy is associated with a shift towards a Th2 signature, elevated antibody levels, improved autoimmune disease symptoms, and increased expression of key immunomodulatory anti-inflammatory cytokines. So I want you to think of a lowered inflammatory response when estrogen levels are at their highest. Now, estrogen levels are lower after menopause. In general, menopause and the subsequent reduction in estrogen is associated with an increase in inflammation and the development of chronic conditions in a variety of organ systems, including cardiovascular disease. Sudden losses in estrogen due to the removal of your ovaries. So when a woman has their ovaries removed prematurely prior to reaching menopause, it can lead to also similar outcomes. So when a woman has a complete hysterectomy prior to menopause, they also can see an increase in inflammation and the development of many chronic conditions. This is also demonstrated that treatment with estrogen therapy can ameliorate the severity of some of these symptoms. See, now what we're getting into is we're getting into the reason why so many women are gravitating towards hormonal replacement therapy. And I have spoken out about it, not only for women, but also for men. I'm an equal opportunity misogynist. There's a reason why hormones are low for men. There's also a reason why a woman gets very inflamed after menopause. The reason why is because the estrogens are actually lowering the immune system response, but it doesn't mean that there's still not an inflammatory trigger. See, that's what I want you guys to understand, is that there still has to be an inflammatory trigger. Here's what they also say. Another potential source of estrogens is hormone replacement therapy, where exogenous estrogens are administered to a variety of conditions, often postmenopausal. Administration of hormone replacement therapy is associated with anti-inflammatory effects and is commonly used to treat inflammatory diseases in older women. However, the use of these treatments for some conditions must be tightly regulated, as HRT is associated with negative outcomes such as increased risk of specific cancers. So one of the traditional roles of estrogen is to aid in development of reproductive tissues, which includes cellular proliferation and growth. This property has been shown to be a major mechanism by which estrogens can drive female-associated cancers. I did a short video about a woman who is undergoing hormone replacement therapy, and you could see that her levels of how she was metabolizing her estrogens was going down an extreme breast cancer pathway. Yet, despite speaking the truth that is actually backed up by science, you need a specific degree. You need to be a hormone specialist. You need to be an endocrinologist in order to have that opinion. But the problem is that the endocrinologists, the experts, are not measuring these pathways. They're measuring it in the blood. They're not measuring how they're getting metabolized within the urine through the liver. So the conclusions is this is why they say, oh, but my symptoms went down when I went on hormone replacement therapy. And I'm like, yeah, that's kind of like if I said, yeah, when I take cocaine, that cures my shyness. Or when I am really shy, but if I have alcohol, it takes my shyness away. It's only covering up a problem that is truly there. So here's the conclusions from this research paper. In general, it has been shown that estrogens exhibit an anti-inflammatory effect that is associated with improved outcomes during severe infection and wound healing repair. So are estrogens anti-inflammatory? The answer is yes. However, this is why so many women are asking about hormone replacement therapy instead of going on a statin drug. They're saying, should I go on a hormone replacement therapy instead of going on a statin drug if my LDL is going up? I want to tell you guys something, though, and this is what's so missed when it comes to inflammation and it comes to the immune system, is that the immune system doesn't respond to things for no reason. That's like saying, should I increase my aspirin because my joints hurt so bad? And we're saying, well, there's a reason why there's an inflammatory process that's going on, and we need to find the reason. This is also true with autoimmunity. People say, though, the immune system is mistakenly attacking its own tissues. I'm like, show me where it's programmed to all of a sudden go from helping you to then killing you. It's impossible for your body to do that. It's not programmed to do that. And this comes down to a lot of your belief system. Is the body programmed for survival, or is it programmed to just mess up, fall apart, and just for you to just turn into some kind of miserable mess because the body's parts are just wearing down? See, it's designed for adaptation. It's designed for survival, and it will always do that up until the day that you die. But as it's trying to survive, it says, let's live right now, even though there's going to be a long-term consequence with how I am adapting. Now, here's another article, the effects of estrogen on vascular inflammation. Remember, we talked about vascular inflammation when we were talking about cholesterol. Here's what they say, because this is really important too, especially when it comes to hormone replacement therapy. I want you to listen to this. Although short-term estradiol exposure correlates with lower expression of tumor necrosis factor, which is an inflammatory protein, vascular endothelial growth factor and interleukin 1 beta in all age group, for most biomarkers, aging was associated with a switch from beneficial anti-inflammatory action by estrogen at earlier stages of menopause to a pro-inflammatory profile after 5 years past its onset. Isn't that interesting? So when people say, give me my hormones, give them to them for my whole life, is that they found a benefit for 5 years and then it switched into, instead of being anti-inflammatory, being actually pro-inflammatory, which makes you wonder why doctors say, let's see if you qualify for hormone replacement therapy, but we're only going to have you on it for a short amount of time. So can HRT help? Yeah, temporarily. It's not getting to the cause, but with all things, the body finds a way around it. Your body will always find a way around it. This is why the smartest doctor is not your endocrinologist, not your hormone expert, and it's certainly not me. The smartest doctor is the one that lives inside your body. That's already there. Your body will always find a workaround when you think that you can take shortcuts and not address the cause. Lipid profile changes during the menopausal transition. Here's what they say. This is a study from 2020, an observational study. And here's what they say. This retrospective observational study of laboratory studies from women presenting in the gynecology unit of a hospital in Madrid, Spain, with irregular menstruation, amenorrhea, or menopausal symptoms. So I want you to think of it. Who did they study? They studied women who already had menopausal symptoms or who already had in the past had problems with their menstrual cycle. This involved 13,000 laboratory studies that were done on 275 women. Total cholesterol, LDL, and triglyceride levels were significantly higher in postmenopausal women than in perimenopausal women. Our study suggests that significant changes in LDL occur during the menopausal transition. However, the women who were studied, all of the women who were studied had irregular periods or menopausal symptoms. Isn't that interesting? So let me ask you a question. If you are having a bad day when it comes to menopause, go back and look at what your menstrual cycle was before that. Did you have a perfect menstrual cycle, meaning were you cycling anywhere from 26 to 30 days, or was it short, or was it going too long, or were you on birth control for an extended period of time manipulating your hormones? Because when you look at the people who had a significant rise in LDL, they were the ones who were having problems with irregular periods or menopausal symptoms. So the thing that I want you guys to understand is this: hormones respond. Hormones respond. Hormones respond. They respond to inflammation and stress. Ladies, the two biggest things that's going to wreck your health is a chronic low-grade inflammatory response that you do not find the reason for it. And number two, it's going to be mental stress. If you don't believe me, look at the sex hormone pathway and look at how, if the body is under an extreme amount of mental stress even, how that will even rob the body of progesterone. That's why when you are mental stress, low body fat, when you are over exercising, this is why you will see that your menstrual cycle starts to go short. You know this. When you are highly stressed, the menstrual cycle goes short. And the reason why is because your body will steal progesterone in order to make cortisol. And that's why your menstrual cycle starts to go short, which happens to a lot of women. Here's another one, management of hypercholesterolemia in postmenopausal women. So increased rates of coronary heart disease occur with advancing age in both sexes, although coronary heart disease rates in women lag behind those of men by about 10 years. There is a sharp increase in cardiovascular disease rate among women after approximately 50 years of age, i.e. when they hit menopause. Studies suggest that around this time of menopause, LDL levels increase by approximately 15 to 25%. Likely, the reduced circulating estrogen levels associated with menopause play a role in the adverse changes in both blood lipid levels and coronary heart disease incidence. Of the available lipid-lowering agents, HMG-CoA reductase inhibitors like statins are the clear choice to decrease LDL cholesterol levels. Okay. Estrogen or hormonal replacement therapy also can decrease lipoprotein A, which is basically a subfraction of LDL, although it's not recommended as a first-line therapy for decreasing coronary heart disease risk. Bile acid sequestrants reduce LDL cholesterol and slightly increase HDL levels. In fact, I just did a short video on the new cholesterol-lowering drug, which called bempedoic acid. They said, hey, it lowers your LDL. This is not a statin drug. These are for people who are intolerant to statins. And we found that it reduced your risk of heart attack being a specific group by about 1 to 2%. However, what they did is they also eliminated 9,000 people from the study, because what it did show is it showed out of those people, even though it was lowering their lipid levels, it was causing an increase in mortality. Makes you kind of wonder why they eliminated them from the study, because it just doesn't fit the narrative. Now, how about this? Menopause and non-alcoholic fatty liver disease, okay? Now, estrogen deficiency worsens non-alcoholic steatohepatitis, or NASH, in mice models with fatty liver. The prevalence of non-alcoholic fatty liver disease seems to be higher in postmenopausal compared with premenopausal women. These hormone changes seem to interplay with an increase in abdominal adipose tissue, also observed in postmenopausal women aging, which can closely be related to severe progression forms of non-alcoholic fatty liver disease. Possibly it increases the risk of type 2 diabetes, mellitus, and cardiovascular disease, improving parameters of metabolic syndrome via modifications in diet and physical exercise may reduce the risk of non-alcoholic fatty liver disease and its related morbidity. So what are they saying? They're saying, yeah, remember, there has to be a trigger for non-alcoholic fatty liver disease. You don't get it just from a decrease in estrogens. You actually get it through certain behaviors, and it's just that the estrogens are covering it up. The biggest thing that I will tell you when it comes to menopause is that the emperor has no clothes. And if you've ever heard of that, when you uncover everything, the reason why you are having such a bad day when it comes to menopause, why your LDLs are going up, why you're having joint pain, why you're having such terrible issues with it, is because leading up to that point, your estrogens were covering up your bad habits. Well, what do you mean, Dr. Thompson? What do you mean by bad habits? I'm kind of offended. Well, it doesn't matter if you knew about them or not. Bad habits are still bad habits. And the problem is that leading up to that point, who was your doctor that was in charge of maybe correcting those habits so that menopause wasn't such a terrible day and such a terrible experience? I get it. I understand it. In fact, no, I don't understand it, but I can understand what you are going through. But the problem is I want you to look at this and say, who led me into this position? Yes, it can be your doctor giving you a whole bunch of bad advice, but ultimately at the end of the day, you are responsible for your health. And I know why people want relief and why they want help so fast, so quickly, because it does make women feel absolutely horrible. But just deciding that I'm going to take a drug or I'm going to take a hormone replacement therapy without correcting any of the causes, it's just buying you time, and it's literally a prescription for you to continue doing the bad behavior that led to this in the first place. Well, what do you mean? I'm watching my diet, I'm exercising. Well, there's nuances to doing that as well. Even if you're talking about nutrition, guys, it's not eating less calories or just trying to lower your saturated fat. The number one thing you have to look at when it comes to your nutrition is, I'm going to say, inflammatory levels when it comes to food allergies, leaky gut. So you actually know what's not going to create an inflammatory reaction. Making sure that you're increasing stomach acid, seeing if you even have a gallbladder, looking at your insulin levels, and then actually designing a nutrition plan for you based off of that. You can even support your hormones by making sure that you're doing things like organ meats, that you're supporting the adrenals with things like licorice, that you're making sure too that you're improving liver function with things like schisandra, even milk thistle in some people, even dandelion root. Everyone is different. Everyone is unique. There's no protocol, guys. And this is what I absolutely hate about healthcare today, is that it's just everything is a protocol. Everything is just a spreadsheet. Everything is a lamination. You look at it and say, this is how I'm going to handle you. As long as these lab markers are here, we're just going to give you this protocol, and we're going to hope that it helps. And if it doesn't, we'll just refer you to a specialist who knows more and more about less and less until finally they're an expert in absolutely nothing. So how do you navigate menopause? Okay. How do you navigate it? Number one, what I would say is get testing. Okay. You have to get tested. Everyone, well, what test should I get? I don't know. I've never talked to you, but people get different testing, whether it's food, whether it's stool, whether it's a no sugar panel, whether it's a thyroid hormones, a Dutch test, neurotransmitter profile, autoimmune panel. Everyone is different. And that's why it requires me to be able to get in front of a person, be able to speak to them, and be able to look at different things that are taking place. So that's why getting tested is so important. Heck, even getting an x-ray is very important, because when we talk about reducing your stressors, you have physical stressors, you have chemical stressors, and you have mental stressors. That's the whole idea of what we do. And that when people are sick, then they have an overabundance of 1, 2, 3, or maybe all of them, and their body is having a really hard time being able to adapt. Number two, things that can help you even without testing is reduce your sugars. We're not just talking about just sugar. We're talking about a lot of processed carbohydrates. I had a woman today, and I said, you really need to stop your sugar. She says, I don't drink soda. I don't have any candy. I don't drink any sugars. I say, it's not just sugar, it's processed carbohydrates. I say, do you eat a lot of pasta? She's like, every night I eat so much pasta. There's no difference when it comes to sugar. If you're looking at white bread, white pasta, than it is from a Snickers bar. Number three, you need to take care of your adrenals. You need to take care of your thyroid, especially when you're talking about LDL. So do you have an undiagnosed thyroid issue? You need about 14 markers to properly address the thyroid, but also how are your adrenals? Because remember, after menopause, your hormone contribution is coming from your adrenals. That's where you're getting your progesterone. It's where you're getting your estrone, and even your body fat percentage has the ability to make some estradiol. Number three, when you talk about endothelial dysfunction, antioxidants. So, you know what the best antioxidant is? It's called sleep. The reason why is because when you sleep, you secrete melatonin, and melatonin is your body's master antioxidant. It's highest at night when you are sleeping in the presence of darkness, and it's how your body repairs. Why do you think you wake up so sore and so stiff? It's not your mattress. It's because your immune system is doing its job at night, and the more it has to repair, the more inflammation that you're going to create, and the sore and stiffer you're going to be in the morning. And then even when you're talking about endothelial dysfunction and also LDL and triglycerides and things like that, this is why doing high intensity exercise can benefit people tremendously. There's certain types of cholesterol that you cannot touch with the statin, that you cannot even touch with diet, is that you need to move those things out through doing things like high intensity exercise. And you can improve your insulin resistance in weeks by doing high intensity exercise and by starting weight training, and to stop going out and doing long duration jogging and elliptical and things that aren't moving the needle when it comes to insulin resistance. If you want to do that, then walk 5 to 10,000 steps, but you're still going to have to get high intensity exercise and weightlifting in as well. So this is why, guys, we talk about the Swiss watch principle, the Swiss watch principle. And this is why when you look at how the body works, it works like a Swiss watch, that all of these gears are getting turned based on what's happening with all of these other organ systems. But what we do in healthcare is we say, you got a skin issue, you need to go to the dermatologist. You got a heart issue, you're going to go to a cardiologist. You have a problem with your joint, you're going to go to an orthopedist. If you have a problem with your thyroids, you're going to go to an endocrinologist. And meanwhile, what they do is they want to manipulate what's wrong, and then they see we fixed it without any other thought of how it's influencing other parts of the body. You see how crazy that is? So meanwhile, one person's saying, we got the cancer, we got the cancer, we got the cancer. And meanwhile, they're becoming toxic and they're going to die from toxicity. Or they're saying, look at you, we're going to put you on immunosuppressant, and look at your eczema went away. But meanwhile, they don't realize that, hey, I suppressed the immune system that actually can cause tumor growth later on in life. And this is why the Swiss watch approach, you need someone who knows physiology and how to take a 30,000 foot view and look at the endocrine system, look at the digestive system, look at the skin, look at the immune system, look at the lungs, look at the circulatory system, and look at the big picture and understand how everything is playing off of everything else. This is why it's so important. And this is why Wellness Way doctors are the best at looking at it from a large 30,000 foot view. But what do we call a specialist? It's someone who knows more and more about less and less until finally they become an expert in nothing. And this is why we've been able to figure out the things where even the best in healthcare haven't been able to figure it out, because we took a step back and we said, what's going on with this Swiss watch, and how can we start improving things so that all of the gears that the watch can create accurate time, because all of these gears are working in harmony, are working in synchrony with one another. Your body's not stupid. Your body doesn't make mistakes. Your body is incredible. And it's time that we start honoring the just miraculousness of the body, versus looking at it as a part that just somehow misfires, miscommunicates, doesn't work the way that it's supposed to. And that leads me into what's on earth is going to go on in the next month when we talk about people's immune systems, when we talk about the next what that I'm pretty sure that they're going to try pushing as well. Will you have a holistic approach to that, or will you live in fear? So guys, I hope that brought value to you. And if it did, make sure that you share this video with other people. I know that for me, it's a lot of work to put these things together and to spend a lot of time away from my family. So please do me a favor, give me a like, give me a share, and make sure that you share this with other people. And again, if you're still watching to this point, make sure, guys, that if you're from the Chicagoland area, get to the inflammation talk, go to the top of the page. You'll see the event that you can register for the inflammation event tomorrow night. You can also register if you are not from the Chicagoland area, register for the webinar if you aren't within an hour from the Chicagoland area. The webinar will give you details on how to work with me remotely. And then please make sure, guys, just do me a favor. If you don't do anything else, make sure that you get registered for the I Disagree tour with Dr. Patrick Flynn in Yorkville, Illinois, Whitetail Ridge golf course. That's Tuesday, October 24th, 2023 from 6 to 9. It's going to be an awesome event. I would be absolutely thrilled to be able to see you in person and be able to meet you possibly for the first time. So menopause and your cholesterol, I hope that makes sense to you. I hope you gain value from what I went over tonight. And I hope that you understand that when it comes to cholesterol, it's responding, and that the estradiol was just covering up some things that were wrong that you may have been doing when it comes to your immune system, and the lowering of hormones is what brought those things out. Just remember this, and this is probably the most important parallel that I can make. is that if you look at a prepubescent girl with very low hormones, remember, they don't suffer from having debilitating joint pain and high LDL and things like that. And the reason why is because they don't have, a healthy girl doesn't have a high amount of inflammation. Inflammation is the reason why. And so now it's up to you to start addressing the cause. So guys, I hope you have a great night. Be well, be blessed, and remember who you are. Thanks so much.